what are called the short external rotators. And this is a group of 6 muscles. They kind of almost form a fan from over here on the pelvis down to the femur. And they're kind of bounded. I kind of think of them as a triangle. And the top part of the triangle is the piriformis. The bottom part is the quadratus femoris. And then you have the external obturator externus and internus. And you have the gemelli superior and inferior kind of in the middle. So the piriformis is the only one that doesn't actually come from the pelvis. It comes from the anterior sacrum and goes to the greater trochanter. So it's going to be like this. And that is a muscle that, besides externally rotating, can also abduct. The quadratus femoris is going to come from the ischial tuberosity to the quadrate tubercle on the intertrochanteric crest. It almost goes straight across. And it actually, quadrate, it kind of looks like a rectangle. And it externally rotates. The gemelli superior and inferior. The superior is going to come from the ischial spine. The inferior is going to come from the ischial tuberosity. And they're going to come to sort of the medial anterior part of the greater trochanter. They're going to externally rotate. And then you have the obturator internus and externus. They're kind of named for where they come off the obturator foramen. So the internus kind of comes from inside the foramen. And it's going to come, again, along with the gemellis, into this kind of anterior medial border of the greater trochanter. And the externus comes from kind of outside of the obturator foramen membrane, also from the superior and inferior pubic ramus, and that is going to go into the trochanteric fossa. Okay, so again, the gemellis come from the spine and from the ischial tuberosity. They're going to come to the spot kind of medial and anterior on the greater trochanter, and the obturator internus, coming from kind of inside the obturator foramen, is also going to go to that same spot. But the externus, okay, coming from more of the ramus here of the pubis, is going to go into that fossa. Okay, for the most part, they list the trail guide lists the nerve of the external rotators is just being off the sacral plexus, which is fine. But there's one exception. The externus is the obturator nerve. Okay, that's the one exception. And all these muscles externally rotate, except the piriformis can also abduct. So moving on to the gluteal muscles, there's 3 gluteal muscles: gluteus maximus, gluteus minimus, and gluteus medius, kind of like the 3 bears: the big bear, the medium bear, and the little bear. So the gluteus maximus is going to come from the edge of the sacrum and the coccyx, posterior iliac crest, and the ligaments that are on the sacrum, sacral tuberous and sacral spinous. And it's going to insert onto the gluteal tuberosity, kind of this roughened spot that begins the linea aspera over here. It's a very large muscle. Okay, it's primarily responsible for extending the hip, but it also is considered an abductor, okay, because its overall line of pull is going to be superior to the head of the femur, and it also is an external rotator. Now we can also talk about just the lower fibers, and the lower fibers are going to be just in here, and the lower fibers can adduct, ADD. But the muscle as a whole is considered an abductor, primarily an extensor, and because it can extend the hip, it can also do a posterior tilt. The nerve for the gluteus maximus is the inferior gluteal. So even though it's the biggest one, it's the inferior gluteal. So moving to the other 2 gluteal muscles, you have the gluteus medius and the gluteus minimus. The medius is going to come from in between the posterior and anterior lines, so up in here, and it's going to go to the greater trochanter. And then the minimus is going to go between the anterior and the inferior lines, and it's also going to go to the greater trochanter, a little more in front, so a little more anterior part of the greater trochanter. The gluteus medius can be best thought of as just like the deltoid in the upper extremity. So we talked about the deltoid in the upper extremity. We talked about the muscle as a whole, right, is an abductor. And then you have, you can talk about a middle, which is going to be pure abduction. You have an anterior part that can flex and internally rotate. You have a posterior part that can extend and externally rotate. Gluteus medius is set up exactly the same way. Okay, it's going to come, it's kind of triangular shaped. It comes at the top. You have, you can talk about the muscle as a whole as being an abductor, or the middle part as being a pure abductor, but you can also talk about the front part that is a flexor, an internal rotator, and a posterior part that is an extender and an external rotator. The gluteus minimus is also an abductor, not as large. It comes a little bit more in front, so aside from abduction, most sources give it the ability to flex and internally rotate as well. And those are the muscles of the hip.